It's alarming. YouTube content creators are suppressing truths and through that potentially spreading misinformation about the surgical treatment of breast cancer. They may do it unintentionally, but the damage is still done. When, where, and how is this done? Here's a screenshot of the podcast video which formed the driving force behind my present commentary, and it was uploaded just a few days before I recorded this video. The video in question features three women, two local celebrities, and a doctor. Through their conversation, these three women were, in a sense, promoting mastectomy as the preferred modality of treatment for breast cancer. How did they promote mastectomy? While they did talk about breast conservation as an option, they did not specify the supporting evidence behind their choice. Neither did they clearly state that the current available facts and research data actually support breast conservation treatment or lumpectomy over mastectomy. The challenge here was that there were statements of truth intermingled with suppression of important details, making it extremely difficult for members of the audience to discern what was left out. So, allow me to unpack the points which were left unsaid and juxtapose them with these statements which were true. Towards the end of the video, I will summarize them so you will be able to see for yourself why the unsaid facts were essential and how they might impact a patient's decision for surgical treatment, so please stay until the end. Now, I shall begin with their first correct comment. It was stated that the incidence of breast cancer is on the rise. This is declared as part of their title. The statement of a rise in breast cancer incidence is corroborated here. This is an excerpt from the companion article of the 2025 edition of the St. Gallen International Breast Cancer Conference, where a panel of international experts who treat breast cancer convened to deliver guidelines on the treatment of early breast cancer. It is their expert opinion that over the next 25 years, global incidence rates are expected to increase by nearly 40%. So, it is true that more women are diagnosed with breast cancer. Secondly, as the doctor said, it is also true that with screening, more women are diagnosed with early disease, for which effective treatment leads to better cure rates. Moving back to the expert article, we see that owing to effective screening and treatment programs for early stage disease, breast cancer mortality rates have declined, and hence, cure rates have improved. So it is true that screening has enabled early detection and improved survival. Now I will comment on the suppression of truth, which may inadvertently be misleading. All three women were involved in this. First, the celebrity, who elected to undergo mastectomy instead of lumpectomy when she could have done so. Next, the celebrity host reinforced her decision for a mastectomy by saying she would likewise have removed the whole thing. And thirdly, the surgeon allowed discussion about treatment to center around mastectomy. There was a clear failure to correctly emphasize that breast conservation treatment is the better option for eligible patients with early-stage breast cancer. It is true that women have the option of mastectomy or lumpectomy followed by radiation therapy, the combination of which is referred to as breast conservation treatment. These two options were discussed by the doctor, but there was no mention of the differences in outcomes between these two treatment strategies, which is crucial for women making a decision for surgery. Let's look closely at what the experts say about the differences in treatment outcomes. In their companion article, the St. Gallen panel of experts believe that patients should be advised that breast conservation surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results, less morbidity, fewer complications, and favorable patient-reported outcomes. All these domains have been discussed in an earlier video of mine, even before the publication of this article. The link for this video is provided in the description below. Certainly, the panelists support patient choice in the decision of the type of primary breast surgery, and after knowing that breast conservation treatment has the potential to provide superior cancer control results with fewer complications and better quality of life, a woman can still choose to undergo mastectomy. However, I believe it is a very unusual person who would choose potentially poor outcomes for cancer control if given the choice. Could it be that information regarding better survival outcomes is recent? And that is why the doctor omitted the information in the podcast? After all, I had presented the 2025 publication of the St. Gallen consensus document, which could have been released just as the podcast was planned, and therefore the doctor did not have the opportunity to review it. The data relating to better survival outcomes with breast conservation treatment is not new. The information dates back to 2007, with this study performed by a team of doctors from Western Australia, led by Dr. Martin. The conclusion from this study was that Western Australian breast cancer patients treated with breast conserving surgery have improved survival outcomes over those treated with mastectomy. Furthermore, between 2007 and 2025, this team of doctors from the United States also reported higher survival for women who underwent breast conserving therapy compared with mastectomy. In the 2023 edition of the St. Gallen International Consensus Conference, the expert panel had stated that breast conserving surgery is the surgical choice for the majority of breast cancer patients. The recommendation for breast conservation treatment as the preferred mode of treatment was first put forth in this 1991 consensus statement released by the National Institute of Health. So you can see that the recommendation for BCT is long-standing and is further reinforced by more recent data demonstrating improved survival outcomes. Unfortunately, in spite of the available robust data, the celebrity podcast we have just reviewed is not the only one apparently endorsing mastectomy by omitting crucial and relevant information to women with breast cancer. If we were to search through YouTube and other platforms, we will find that among content creators, there are several who are also inadvertent advocates for mastectomy by omitting the option of breast conservation treatment when speaking of mastectomy. So, I think it is time there were more advocates for breast conservation treatment and fewer inadvertent advocates for mastectomy. Here are other doctors who advocate lumpectomy or breast conservation treatment, as well as a patient's vlog on her positive experience with breast conservation on social media. A shout out and thanks to my fellow breast conservation advocates. Intentionally or otherwise, you have raised awareness of breast conservation treatment, which aligns with the purpose of this channel, which is to provide women with data-driven evidence about the treatment of breast cancer so that they can be clear on their choice of surgical treatment. So thank you. In summary, I will refer once again to the podcast which served as the impetus for my present commentary. These were the statements of truth in that video. First, there is a rise in the incidence of breast cancer. This is corroborated by research data. Secondly, mammographic screening leads to a higher proportion of women with breast cancer being diagnosed at an early stage. Thirdly, women with breast cancer have a choice of mastectomy or breast conservation treatment in the majority of cases. However, there is clearly a suppression of available evidence and consensus guidelines in the podcast. Firstly, it is not said that international experts who treat breast cancer recommend breast conservation treatment, or BCT for short, as the best option in most cases. Secondly, there is failure to mention that robust data demonstrating better survival outcomes or cure rates with BCT compared with mastectomy is available. This adds to older data which already demonstrated equivalent cancer control. It should therefore be clearly stated that BCT confers comparable, if not superior, cancer control compared with mastectomy. Finally, it is not explicitly stated that BCT is associated with less morbidity, fewer surgical complications, and favorable patient-reported quality of life. All these domains are crucial for women making a decision about surgical treatment for breast cancer. I hope this uncovering of suppressed information will help patients make the right treatment decision for themselves. Thank you very much for staying until the end of this video. If you have found this information useful, please like, share, comment, and subscribe so that together we can get the right information to the women who need it. If you wish to have more details on the articles which I have cited here, please visit the Just Medicine website and submit a request. I'll be really glad to be able to get the right data to you. More evidence on breast conservation treatment coming your way. Please stay tuned. Until we come together again, take care.